But whoa, it has worn off, I'll tell you, over the last couple years, and I'm ready to be flawless. So, Michelle, tell us what Botox is, what we're doing today, what we're focusing on.
Yes. So Botox relaxes the muscle. So when we talk and think about fine lines and wrinkles that we get in our face, we think of, is it from muscle movement? So, for example, Kelsey, show everybody how you make your mad face. Yeah, muscle movement there. Surprised face.
I love this face. I do this face all day. What? Hello? Good morning. Good night.
Especially to your kids too.
Oh, yeah. What are you talking about?
And then the crow's feet around the eyes from smiling a lot naturally.
Oh,
exactly.
I just smile all day. Yeah.
So when the muscle moves like that, that's what creates that wrinkle. So then Botox will relax the muscle so that you can't make that line anymore. Mm-hmm. It takes a few days to kick in.
Sure.
But once it's working, everything looks so smooth and flawless. So, yeah.
And in the past, I know that Botox can be a proactive thing too, because it helps you to not form additional wrinkles. So it's not like get it when it's too late. If you get it early on, then you're not making that face that makes the wrinkles.
Exactly. So then that's when we call it like prejuvenation. Doing it before you need to rejuvenate.
I like
fancy,
that.
right?
Yeah.
So people that are noticing their muscle move but aren't getting the crease or the line there can do it to prevent a wrinkle from forming. So yes, we get a lot of people in their 20s, 30s that will start then.
Mm-hmm. Some people are nervous about Botox and getting it for the first time, and perhaps, I know sometimes people think there might be a stigma, you know. I'm way past that, but what do you tell those people who are interested but a little nervous?
Yes. I tell people that we're going to give you natural looking results, to not be nervous about it. I think a lot of people think that it's going to look overdone or real fake. I can guarantee you there's plenty of people that you know that get it, that aren't telling you they're getting it, right? Or that you don't notice because it looks very natural. And we can start with a single area to try and see if you like it, or we can go for all three areas like we're going to do today.
Right. You know, I'm always very sensitive about my forehead because I make that surprise face all the time. But when I have had Botox in the past here, it just smoothed it out. It wasn't like I'm paralyzed or I look like a Muppet or whatever. It just smoothed it out and gave me some youth, you know?
Exactly.
So that's what I want you to do today, baby.
I will do that.
Okay. And what areas are we going to do?
So today we were talking about doing the three main areas. So the glabella muscle, which is between the eyes.
The 11s.
Yes. The forehead muscle from the surprise face. Yep. And then the crow's feet. So right around the eyes, which is a good treatment, especially in the summertime. We notice we're squinting more with the sun and with our sunglasses. Some other areas that we can treat are, we call it the bunny lines. So that's when you like scrunch your nose. Yeah. We can do a lip flip, which is when we notice maybe a little bit of lines around the top lip, but also maybe you're not ready for fillers or adding volume to the lip. You can try a lip flip just to relax the muscle, like right through here, and show a little bit more pink of the lip. We can also do the chin. Some people are bothered by the muscle in the chin. And then there's the masseter muscles, which are when you bite down. So like right through here. Yep. People that clench at night might notice that. It also helps with facial slimming.
What about underarms? Does anyone get that?
You know what? Yes, you can do Botox to the underarms to help with sweating. So that's something we can certainly talk about.
I'm good. Just curious. So, what's the prep like? I mean, when a person comes in for Botox, what do we do?
Perfect. So nothing really that you have to do beforehand, other than maybe possibly avoid any sort of like ibuprofen or aspirin, anything that would thin your blood, because we are doing injections. But otherwise, as long as you come in, we'll talk through everything to see what your goals for treatment are like, and we'll come up with a customized plan for you. So Kelsey and I did talk. We know what areas we want to focus on, what bothers her, and that's really it. There's a few things after treatment too that we will discuss.
Okay. And also right now, if you're new to Botox at CAPS, Columbus Aesthetic and Plastic Surgery, if you mention iHeart or Kelsey Webb, you'll get $50 off. Just go to columbusPlasticSurgery.com. So let's get it started.
Ready? All right. Did we make fun of you?
I sure do.
Okay.
Of course I do. I spray tan last night myself. And there's a lot of interesting things happening here.
And if you guys have any questions for Kelsey or Michelle, please feel free to put them in the comments and we will make sure we get them answered today.
Please, thank you.
Yes.
So, I mean, I've had a lot of treatments and procedures done here at Columbus Aesthetic and Plastic Surgery, and I feel like the other ones that I've had have helped the texture of my skin and the unevenness and the brown spots, and wrinkles too, fine lines and wrinkles, but Botox is really the way to plump it up, right?
Yes, and exactly with the idea of doing it in conjunction with these other treatments. And that's something we can also talk through too, is like, what is it that really bothers you? Is it the lines, or maybe it is the texture, or some of the pigment associated that we get as time goes on with sunspots and age spots, some things like that. So we can also help in a consultation figure out the best treatment plan for you.
Awesome.
Yeah.
I don't care about needles at all, so I'm not nervous. We could do a tattoo while I'm here. If you're good at that.
No, I will not do tattoos for you.
Okay.
I can send you to somebody.
Okay.
All right. Go ahead and make that mad face for me. Perfect. There you go.
I'm fixed. Just kidding.
Almost.
Good. Now with Botox, it does take 2 to 10 days. So sorry, Kelsey, you have to wait a few days for it to kick in.
I do recall that.
So the muscle will still move for a few days, but in the next coming days, it'll start to really relax.
Love it. And it's a needle, but it's a prick. It's not a big deal. Doesn't bother me.
The needles are pretty small, aren't they, Michelle?
Yes. So we use insulin needles, so very small, minimal. And I think you notice too, it's quick when it's in. Yeah.
No big deal.
For everyone who's just tuning in with us, we are live with Kelsey Webb from WNCI and Michelle, who is one of our certified nurse injectors here at CAPS, and we are talking Botox. So if you have any questions, please feel free to put them in the comments. We will get them answered for you.
I don't want to talk, so she misses a surprise line.
Same. I'm not gonna miss them.
Well, while they are finishing this up, if you guys are new to Botox at CAPS, we are offering $50 off if you mention iHeart or Kelsey. So again, new to Botox at CAPS, $50 off your first treatment when you mention iHeart or Kelsey.
And then last but not least, the crow's feet.
Gotta do those eyes.
Yes.
I'm gonna be 40 this year, Michelle. Oh my God, can you even? How'd
Hey,
that happen?
This is a great birthday present to yourself,
Yes.
though. I
There you
love
go.
it.
You will go into that birthday looking fabulous.
Oh, just gracefully.
Yes.
I've definitely noticed the eyes are the latest things to really take a hit. That skin gets thinner, and it's at the wrinkles still there after I'm done smiling. That's what we don't want that. So let's fix it.
We will. Perfect. So some things to remind you about after treatment include just making sure not to rub, touch, or press this area for about 4 hours. It takes 2 hours for that Botox to fully bind to the muscle, so we just want to make sure it doesn't move. So easy enough, just don't rub, touch, press it. Try not to lay flat for 4 hours, and no vigorous exercise for 4 hours.
Good. I was planning a marathon, so I guess I can.
Good. And then pretty much that's it. By 4 hours, you'll be looking just fine. And then you may notice too, it does sort of look like a little mosquito bite for about an hour.
Yeah.
And then it goes away.
Okay. And then again, the full results you get in about how many days?
About 2 weeks total.
2 weeks.
Yep.
Okay.
Yep. But you could start to see changes early as 2 days.
Yes, for sure. I'll plan my big photo shoot then. My boudoir shoot. Just kidding, JK. No. We're done?
We're done.
How easy was that? It was like 10 minutes.
Yeah.
No big deal.
How you feeling?
Fabulous. I'm so excited. I think I'm gonna go celebrate with some Subway. Or something yummy.
You should.
But again, we're here at Columbus Aesthetic and Plastic Surgery with Michelle, Nurse Injector, and Botox is just one of the gazillion ways you can look better, feel better, live better, and CAPS is just the best environment. So happy. You promote health and wellness and well-being, and I will keep you updated on my results. And if you're new to Botox at CAPS, $50 off right now if you just mention iHeart or Kelsey Webb, WNCI. Thank you, everyone.